My name is Max Adcock, and I'm the administrator for the Surgery Center at Mississippi Sports Medicine in Flowood, Mississippi. Sure, we're an orthopedic, ASC, Orthopedic and Pain Management. The ASC branch started in 2014. We expanded to an 8-bed center in April of 2019, and then grew to 12 ORs and 7 procedure rooms just earlier this year. So we currently do all orthopedic procedures, total joints, total shoulders, hips, knees, all spine cases, as well as pain management, shoulder, ankle, knee, everything else. So HST Pathways was actually implemented prior to my arrival. I think they started using that around 2017. We transitioned to HST eChart in October of 2021 after using paper for a long time. Yeah, I think paper charting is a pain point. Through paper, it's hard to gather data. It's hard to look and see how well you're doing, and especially improve efficiency. Kind of led us to use an eChart for an EHR. We wasted a lot of time printing charts and getting them ready for the next day. We also wasted a lot of time scanning those charts in, and whenever we had chart audits, whether that's for peer reviews, for quality reviews, digging through stacks of paper, digging through charts that have been scanned in, just took a lot of time. So we, reluctantly moved to computer charting for, the staff didn't really want to make the change, physicians don't want to make the change, but to be able to gather that quality data and improve efficiency, it was really a step in the right direction. Sure, yeah, doing peer reviews, doing chart audits, you can literally just search like on Google for a patient name or a data service and pull up the chart, review everything in the chart. We can export all of that data to be able to look at our OR times, pre-op times, PACU times for each specific doctor for each surgery, so we can really generate case costing, so we can see how much time is spent for each case, how much staff is for each case, and really improve our efficiency. Yeah, 100%. We use a lot of different HST products, Pathways, eChart, case coordination. It really simplifies the process even before we get the patient in. We can reach out to them via text for an estimate. We can add that data into HST Pathways as we check them in to see everything as it's integrated. Then as we enter everything through eChart, we can text the patient through phases of care and just make sure the patient and the family are all in communication about how well we're doing. I think the improved efficiency all across the board through each phase of care throughout the center, really it's a seamless model for us to use. And I think all the different products that HST has to offer, from the patient estimates through Clarity up to any type of pre-admit questionnaire, and then even sending out patient satisfaction surveys afterwards. It really improves the process. Sure, we're able to really dive into case costing. As I said, we're really looking at how much time each surgeon is spending in the OR and how much staff it's taking to complete those cases. So we're able to really go to each doctor and understand what the variables are in each thing and really improve our process and efficiency. Sure, we don't have to have an FTE who scans in charts every day. We don't have to have some summer help that we were using to go through charts and help do peer reviews. Just the ease of use and having to be able to search a chart, dig for the information. We've been able to at least not get rid of one person, reallocate one FTE towards different opportunities. I think what we look forward to is the different products that HST has and how it improves integration across the model. We're looking at, as different products will flow into eChart, it'll make the patient's preoperative experience easier, as well as post-op phone calls and any kind of post-op surveys to just improve our outcomes. It was really easy. There's a lot of work that we did prior to implementations. We were able to customize eChart exactly the way that we wanted it to be, so that working with staff, as soon as we implemented and started going live with it, it was a seamless integration. With staff being able to trial it beforehand, go through the process, make their recommendations, and us be able to implement those changes prior to go live, it made it super easy. Great. Normally we'll call them if we have any issues, and we'll get a response the same day. Normally they'll either jump on the computer and do a screen share and be able to see exactly what you're seeing so they can fix it, or they'll dig into it deeper with IT team and let us know the same day how it's being fixed. Yeah, it's been great. I think as HST continues to look outside the box and tries to figure out what your problems are and how they can offer software to fix it, I think that's where every ASC needs to go. As I said earlier, the physicians are very reluctant to move towards computer charting and EHR, but once you explain to them how much easier it is to do everything, and that's the pre-op, the quality, every single aspect of it is easier now with electronic documentation, it's really easy to push that to them and get their buy-in.